cleaning with earbud, it will push it deeper.
If you have ringing on one side,
Right.
at least a good clinician will get an MRI to rule that out. It doesn't mean every ringing is dangerous. 95% is not, but 5% can have that. And simple things like even chewing gum or yawning can help you open the tube.
Some viral illnesses causes loss of smell. COVID caused a temporary one, but there are some viral illnesses which can cause permanent ones.
Nicotine in any form is bad for the body. Vaping also is as bad as smoking. Patient must be sensitized. Once a year, I must see my ENT. Snoring is a nuisance for the partner, but sleep apnea is a more serious problem.
From ears to your throat, tiny everyday habits could be causing big health problems. Today, our ENT experts decode the warning signs you shouldn't ignore. This is Your Health Decoded. Let's get started. I have with me Dr. Handa, Chairman at Medanta for ENT, Head and Neck Surgery, and Dr. Aru Chhabra Handa, Director at Medanta for ENT, Head and Neck Surgery. Thank you both for being here. So, when we said we are getting both of you, there were a lot of questions, and I'm sure you're going to find a lot of these questions very common and everyday, but for our audience, please. So one of the main ones was that we often treat earwax as something that's dirty, that has to be removed. So how important is it really for ear health, and when does removal become necessary?
See, wax is a normal secretion of the ear, just like you sweat. So there are cerumen glands in the ear which produce wax, which is supposed to be protective so that foreign bodies don't enter. Some insects, they get stuck to that, but they can become problem if they block the ear totally, so the person will not be able to hear better. So that is when they need to be removed.
So is it like once a week, once a month?
Maybe once in 6 months or once in a year, but the thing is that person should not try cleaning themselves. So
you mean the earbuds I take don't work?
No,
okay.
No. What happens if you try cleaning with earbud, it will push it deeper. There's a very narrow canal and the buds are bigger in size. So if you try to clean it, it gets folded and gets pushed deeper.
So what, I have to go to a doctor for it?
I think.
Really?
Yeah. It's a self-cleansing thing. You don't have to remove it.
But sometimes it does.
What happens with the movement of the cells, it keeps moving outwards. So it's a self-cleansing thing. You don't have to remove it. Many people don't even get it cleaned throughout their life. So you don't have to actually get it removed. It gets pushed deeper in if you try to clean it, and that is when you need to go to a doctor to get it clean. But some persons have a very narrow canal. So they are the ones who need it, or they have a tortuous canal.
But how do I know if I have a narrow canal?
So see, I will explain it differently. If you have any symptom, if you feel heaviness in the ear, then you need to see a ENT person. He can have a look, because it may be an impacted wax.
Okay.
Now it is not everybody will have this problem, but if you have, then your wax, you need to put some ceremenolytic drops. This softens the wax, and the doctor can remove it easily.
Okay.
Otherwise, because this part you can't see yourself, so it is better to have it seen under vision and then taken it out. You must have seen on the street side there are people who have the expertise.
Yeah, exactly.
Only problem with them, with due respect to their expertise, is it is a blind procedure, and you have your ear drum just not very far off, maybe 2 centimeters from the outer opening, and any small trauma on the drum can rupture it and cause hearing loss.
Right. Speaking of ears, one of the other things is this, a lot of people now talk about constant ringing. What is that about? So
ringing this is in a loose language called tinnitus. Now this is a very common symptom.
Right.
If I see 10 patients in a day, 1 to 2 will be of ringing. Now we must understand, 95% times it does not denote anything serious, except 5% where it can be related to a brain tumor. There is a CP angle where
you have just woken up everyone here. Ringing in my ears, do I have a brain tumor?
So that 5%, if you have ringing on one side, at least a good clinician will get an MRI to rule that out. It doesn't mean every ringing is dangerous. 95% is not, but 5% can have that. Secondly, ringing may be because of noise trauma. People who are working with heavy machinery, there is cracker exposure during Diwali time, or they listen to very loud music, then you can have ringing. And with ringing, there may be some associated hearing loss. Now, ringing, the best way to handle ringing is, one, let it be in the background. Don't think too much about it.
Oh, so just let it continue.
You just let it continue. You be busy doing work, it will not bother you. If you start getting too bothered, and then it doesn't, it in fact bothers you more, it doesn't go away like that. And do avoid silent places. If you are in a silent environment, you will hear your ringing more. But if you have something background, even a fan, even a AC, even some light music, that masks your sound. So this is one of the ways we treat ringing. We ask them, there should be some ambient noise.
No, so doc, so that means that they're going to live with that ringing for their lives.
Not necessarily.
Actually, ringing is a symptom. It's not a disease.
Okay.
It's a symptom of hearing loss, which could be because of noise induced, like you said, or aging.
Okay.
Aging is very common.
Oh.
Or you have had some ototoxic drug, like medicines which affect the hearing, or it could be a nutritional deficiency also, like B12 or vitamin D deficiency, or it could be, if it is pulsatile, it could be some hypertension, PP is high, and then you hear your pulsations in the ear. But once we know that there is no serious cause behind it, and it is just there, it's part of a symptom of any ear condition which can cause a hearing loss.
So just let it continue.
So we just counsel the patient that it's going to be there, it is going to stay with them, so don't be bothered about it. Once we know that it's not serious, it's not something sinister, like he said, if it's unilateral, not both the ears, so then we need to see why it is only in one ear, whether the hearing loss is in one ear or there's something pressing on the nerve on that side. So that is very, very rare cases.
The percentage is only 5%. This serious, only 5% it can be serious. 95% it is innocuous.
Right.
It goes away, but nobody can predict when it will go away.
So best to go consult a doctor if there is ringing in your ears.
More they think about it, louder it is going to be. Like if there's a kachara there, you always keep thinking like there is something there.
It's going to bother you more. Right. So on the sort of thing of ears, you know, when another thing that was asked to us a lot is that when people fly, right, and when they come out, and then that whole thing of you hold your nose and you know your ears pop, but a lot of them say that they lose their balance.
So,
and you know, it's like they don't know where they're going. Now, why does that happen?
With flying, let us understand, there is a tube which connects your nose and the ear. It is called eustachian tube.
Right.
One of the purposes of that tube is to equalize the pressure.
Okay.
So when you go up, there is a difference in pressure. So you may have, commonest symptom is some heaviness in the ears, ear pain. It is because of the negative pressure created. And simple things like even chewing gum or yawning can help you open the tube.
Okay.
Now the second thing about dizziness with flying, less common, though it can happen, but much less common than this heaviness, and normally it is self-limiting. It is more likely to be related to the eustachian tube rather than the inner ear problem.
But why is it that some people have more and some people have less? Is it to do with the structure?
If you travel, you fly with your nose blocked, the tube is going to get blocked. Suppose you have cold, cough,
right,
or some people have a tendency for allergies or sinus problem.
They'll have it more.
Yeah, they'll have it more. So it's better to use some decongestants before they fly. Throughout the flight, they should keep taking sips of water. It is more when they are landing.
When you're landing, right.
So yawning, pressure, that thing that you said, keep taking sips of water, candy in the mouth, swallowing opens up the tube. Something, yeah. Keep warm.
Keep warm. That's interesting.
Some nose drops like Otrivin is a common oxymetazoline.
Right.
So if you put it in your nose, it helps in opening the tube.
Right. Otrivin is a great idea.
But not to be used for long.
Long time.
There are side effects of Otrivin.
So, okay, now to the other big question. Now we have these kids, and I know everyone says you don't wear headphones all the time, but you have these kids, with their wireless or whatever. How bad is it? What is the worst? How long can they keep headphones or earphones on? Like just 3 do's and 3 don'ts.
See, it depends on the volume they are listening to.
Okay.
If the volume is just like a conversational volume, they can use it for a longer time. But
What is long? Let's say in a day, how long?
see, if it is 30-40 decibel sound, so they can continue using, but the kids don't stop at that volume,
Right.
so they use a higher volume.
Huh.
So we have to quantify. If you have to quantify, how I will counsel them is, one is the volume. Very true. You should not go above 40-50 decibels.
Right.
Duration not more than 2 hours in a day. You wear your headphones or earphones. For any reason, if you have to use a speaker phone,
Right.
because longer durations you allow them, then they have loud music pumping in the ears, and then the problems start.
No, because nowadays, whether it's Zoom calls or,
So they for work, if there is a call center employee, he asks me, I'll give him a longer. But for a child who just wants to use it for listening to music
or watching a film or something.
Correct. So we will
Got
reduce
it.
it.
Okay. Now, this whole thing of loss of smell post-COVID has become quite a thing. Is loss of smell under normal circumstances, is it reversible? Or if someone experiences loss of smell, what does it mean? Other than like sometimes a normal blocked nose, is it a sign of something else?
See, roof of the nose, we have these olfactory fibers which convey the smell to the brain. Some viral illnesses cause this loss of smell. COVID caused a temporary one, but there are some viral illnesses which can cause permanent ones also. Like COVID, 4 to 6 weeks, the recovery time was there. Then again, there are some allergic polyps if the polyps are high up towards that area.
Right.
So the air will not go there. So that also causes recurrent rhinitis. If there's any inflammation in that area, so one can lose smell.
And how is it? Like, for instance, just my example, I can never smell anything. Like, I can smell some really bad things or but in general, like I have seen my husband or my children, they'll walk into a room and they'll be like, something is, and I have, so how does that work? Like some people are very sensitive, some can't
So
smell.
loss of smell may be related to, as she said, one of the common things is allergy. If you have allergic rhinitis, a lot of sneezing, discharge, even shorter polyps. Polyps is the later step when these swellings form in the nose. Because of that, you may have loss of smell. Viral infections, you can have loss of smell. So it will be particular to a person why the loss of smell is there.
Okay.
COVID time, we had a lot of people, and half of them reversed back, many did not.
Did not. So that's like a permanent thing.
Yes, in those who did not, it's a permanent.
It's a permanent thing.
See, the deviated septum also. Some people have a higher deviated septum. So, the anatomically the nose has some variation which can block the air to go up towards that. So
I think that is pretty much it. So I can always say it's just the way. Okay, the other big thing was a running nose. A lot of people asked us, why is it I don't have fever, I don't have a scratchy throat, but my nose is constantly running. So what is that about?
So the commonest cause is allergic rhinitis.
Okay.
You have allergy to, it may be to dust mite, which is the commonest allergy. It may be to certain other allergens. There may be triggers like AC direct blast coming in your face,
Right.
sudden change of temperature, environment, deos, perfumes, dhoop, agarbatti. All of these can be triggers of the allergy starting. Then there is another condition called vasomotor rhinitis, where you have a lot of discharge from the nose. This is related to the neural system, parasympathetic and sympathetic. This thing, if there is overcharge of that, you may have discharge.
Right.
like
Then sometimes there is a rare causes. You have brain fluid, also called cerebrospinal fluid, that may just come out through the nose, especially if you have discharge from one side and following an injury, trauma, accident. That's more serious and it needs a repair.
Right.
But commonest is because of allergy.
But in a city like Delhi, I mean, how far are you going to stay away from an AC? So is there something one can do?
You stay in an AC room, but stay away from the vent.
Oh, so nothing directly
Direct
to
on
you.
the face.
Got it. Another one, scratchy throat in the morning. So I wake up, I cough a lot, but then I'm fine during the day. What is that about?
See, what happens daytime, we keep swallowing.
Right.
And we keep clearing our secretions. Throughout the night, the number of swallows become less. All that post-nasal drip sometimes gets collected there. And so that is what explains more of scratchiness or throat problem in the mornings. Once you clear your throat, you take out mucus, it clears up.
It clears up. So another one that was this whole idea of reflux and acidity causing problems in the throat.
It's a very common.
Yeah.
There are patients, it's more ladies, who come with something stuck in the throat. It's called global sensation. Feeling of something stuck, and the commonest cause is reflux. Your acid, stomach in the acid, it does a backup. It comes up in the throat, especially at night when you are sleeping, and if you are sleeping flat, your head is not higher. So it is more common than what is anticipated, and it is associated not just with the throat problem. It can even go in the ear, it can go in the nose, and indirectly cause a lot of issues.
Wow.
So today it is a very, very hot subject, and with simple lifestyle modifications like don't stay hungry for more than 4 hours, eat less, but don't give the too much gap. Empty stomach, more acid, it backs. Then at night, sleep with a pillow. Head should be higher than the body. Don't have too much of irritated drinks, fizz drinks, tea, coffee, everything within a limit. Don't wear very heavy belts which press on the stomach. So not very tight clothing. So these simple maneuvers, along with a very common type of drugs called proton pump inhibitors, your pantoprazole, rabiprazole, esmaperazole.
They could do that.
Yeah. Then these patients are put for a long time on that. But it's a very common cause of these throat symptoms.
It's so interesting you're saying this because, one of our colleagues here, when he heard the two of you were coming, he's like, there is nothing happening, but I'm finding it very difficult to swallow. So I said, have a conversation. Now I'm thinking we should tell him this. Okay. Now we're going to get to vaping.
Yeah.
With this new generation, which says, okay, we're not going to smoke, but vaping's all right. Now, explain to our viewers why vaping is harmful.
I'll take that. Yeah.
Okay.
So there is a group formed. I was approached by that group. That is by mothers of children against vaping, and they had a vaping anti-vaping day, and there was a lot of press releases on this. Now, see, vaping is as bad as smoking.
Right.
It is not a substitute for smoking, and there are a lot of side effects of vaping. However, one tries to justify that electronic cigarettes are better. It is not. In fact, it is as bad as smoking. So anybody giving a message that you can substitute vaping with smoking is not at all correct. So this message should go in, and nicotine in any form is bad for the body. It is not just in the smoke form. If you chew tobacco,
right,
you see how common oral cancer is, and the commonest cause is tobacco chewing. Vaping also is as bad as smoking.
So the same sort of symptoms or the same effect that's, like let's say a person uses that vape or whatever, like how many times a day is equivalent to a certain number of cigarettes.
Yeah.
So there isn't.
Adding on to this, like nowadays this nicotine chewing gums are available. They are used to de-addict you from the smoking. But only thing is that smoking has effect on chest, lungs and body. Once it goes to the nicotine goes to the body, cardiac effects are there. So nicotine chewing gums and like used for de-addiction, they'll have same effect on blood, through blood to the heart, but it's only that lungs will be saved. So people become addicted to that nicotine. That's used only to de-addict you so that you can taper it off later on.
Right, so it's leaving one and getting...
But they continue using it. If they use it just to
get off cigarettes.
The cigarette, that's
It's
fine.
fine.
And then slowly taper off that. But some people continue using those nicotine chewing gums also.
So, when you're speaking about mothers, a lot of mothers were asking this question about nosebleeds, because a lot of children nowadays, young children are getting nosebleeds. But it's often seen that they go away with time. So what are nosebleeds about? How serious is it? What should be done?
It's very common in children to have nosebleeds. The skin, the mucosa is very, very tender. And more so in summers and extremes of winters when the nose becomes dry.
Right.
So the bleedings are more common. There are more blood vessels in the front part of the septum. So these are not very benign bleeds, I would say, that they go with age, or once you take care of the nose, moisturize that, use some oil, use saline sprays and drops. And if it happens, you just need to pinch your nose for 5 minutes and then it stops.
Goes away, right.
That's the benign type.
Right.
But again, we should rule out if the bleeding is too much, profuse. Then there are certain tumors also, especially boys, young age, or we have to rule out. If it's few drops, just little abrasion and bleeds, they stop and they
common
go
habit
away.
is nasal picking.
Nose picking.
Children have a habit of picking the nose. That is also a very common cause of nasal bleeding.
Right.
Plus some clotting disorders where blood doesn't clot properly.
Got it.
And liver disorders, because the whole coagulation mechanism is based on liver. So if there is a liver derangement of some enzymes, that can also cause bleeding, nasal bleeding.
Okay. Now, chronic sinus infections. How bad are they? What are the long-term complications? What's to be done?
So they are very common. Chronic sinusitis. We must differentiate it from allergy. Allergy is just discharge, sneezing. Sinusitis is discharge, sneezing, collection of this mucopus in these sinuses. These are hollow spaces in the bone.
Right.
And they may give symptoms like headache, post-nasal drip, and the symptoms may range from very mild to severe ones. Initially, they are managed with medicines conservatively: steam, antibiotic, decongestant, local, systemic. But if they do not respond and it is chronic, then at times we have to do a surgery called endoscopic sinus surgery, which means all the sinuses are cleaned, their openings, ventilation restored, and the pus, mucus, fungus, whatever is in the sinus is cleaned.
And sinuses very often, again, lead to a lot of headaches, where very often your GP will just say, why don't you just do some steam, open up your sinuses. So again, what is that situation where, a person has to think, okay, this is not just going to go away, I should consult a doctor. Are there sort of any particular symptoms to look for?
See, if it's once in a while, you have cold and you have headache, which will go away in 2-3 days. But if you have persistent headaches, which are not going away with conservative medical treatment, then you should see a doctor.
Right.
You feel heaviness in the frontal part or cheek
Cheeks,
or teeth, some pressure is felt on the teeth also. So that is the time when if it persists,
then you have
to.
Okay. Dr. Handa, you spoke about nasal sprays earlier in the show, and a lot of people asked us, are they dangerous, and sort of how often to use them, not use them, what to do?
So nasal spray, I assume you're talking about steroidal nasal sprays, which are the commonest ones used. They are not dangerous. This is local steroids. Though they are steroidal, it is not oral steroids, which have more side effects. So they can be used in conditions like allergic rhinitis for a long time, but under proper medical guidance.
Right.
Because they do have some side effects, including they cause dryness. At times they may be the reason for fungus forming. Plus, it is not that they are without side effects. So they are very commonly prescribed drugs, but it should not be over the counter, and the patient should not start taking it whenever he has slight symptoms. So it should be under medical supervision, and we have patients who use them for a long time, 1 year, 2 years, with breaks in between. Yes.
Okay.
There are two types of sprays. One is the steroid, which is locally active.
Right.
It doesn't actually go into the blood. But then we talked about decongestant also, xylometazoline and oxymetazoline. They should not be used for more than 7 to 10 days. Some people become dependent on that. The nose opens up immediately. There's a dramatic relief in the blockage. But over time, one becomes dependent on that, and it causes more blockage
than actually helping.
Yeah.
Got it. Okay, how important is regular ENT screening for people who have a family history of hearing loss or sinus cancers or throat conditions? Is there something that should be done? Because that is something people go for dental checkups and they go for eye checkups. Really, nobody goes for ENT checkups.
So it is very important, because if you just take a ENT history or do a ENT examination, you can pick up a lot of diseases.
Okay.
You'll be surprised. Say, past 4-5 years, I have picked up at least 3 aortic aneurysms just because the voice was hoarse. Right.
Wow.
They came with a change of voice, and we got a CT scan, contrast CT done, and it was showing aortic aneurysm. And the cardiothoracic surgeon, he said, patient is lucky. So, oral cancer, if you don't examine the mouth, what is stage 1 treatable, almost fully curable, may become stage 4. Throat cancer. So, lot of these conditions, by a simple ENT examination, you can pick them early.
But doc, when you go to all these hospitals where people go for annual checkups and they have all these packages where they'll do your ultrasounds and they'll do your echo and TMT and all of that, or your complete, there's no mention of any ENT.
No.
There are few packages who have ENT, but I think more important.
I can't name the hospital, but I was like, I just went to one in Gurgaon, there wasn't there.
Okay.
Yeah.
Okay. Now, see, they should include more packages, though there are few packages, at least in our hospital, who have ENT. But you must be sensitized, patient must be sensitized. Once a year, I must see my ENT, especially after a certain age.
And what is that age? 30, 40? 30, after 30.
You must see. And even if there is no specific problem, because after age of 50, your hearing slowly, age-related hearing loss starts. If that is picked up early, you can help out the patient.
Right.
Then
I think after 50, people, voluntarily want to hear less anyway.
Yeah.
They're like, I just don't want to hear.
There are other problems also, like we can, seeing the throat, we can predict that this person is going to have sleep disordered breathing, like
really
OSA, snoring,
that's another.
if the structure of the tongue
but
is
what
bulky.
can be done about it?
So they can work on their weights, they can do some oropharyngeal exercises to tone up their muscles, and that's the preventive aspect. Weight reduction is very, very important.
Because all that leads a lot more to snoring.
Or there may be a deviated septum or a turbinate hypertrophy. Right. And if they do it at a proper time, sometimes snoring itself causes so much of edema of the palate, uvula, so it can be preventive also. In that.
See, snoring, sleep apnea again is a lifestyle problem. And with the affluence, there was a study in South Delhi schools, and they found that government schools, the incidence was almost nil, but in a upbeat public school where you had affluent kids, it was very high.
Wow.
So here, if you do a proper examination, snoring is a nuisance for the partner, but sleep apnea is a more serious problem. You have intermittently, there is a cessation of breathing, the breathing stops, and this has an effect indirectly on the heart and a lot of body systems.
And now people are getting those machines to
at one stage you may have to be given those machines called CPAP, BiPAP at night to keep the health intact. So if it is picked up early, even lifestyle changes, which is only two, mainly is weight reduction, and weight is diet, 70% is diet, 30% is exercise. If that is inculcated in a lot of adults, half the illnesses will go away.
Okay, you spoke about how somebody came with a hoarse voice and you detected an aneurysm. I wanted to ask you, what is the strangest thing that you've removed from someone's ear or nose or throat in your long experience between you?
Okay, interesting. Leech in the nose.
Oh.
So we had leech is in the rainy season, a lot of these places. So there was a leech in the nose and he came with a bleeding. And leech problem is...
He didn't realize a leech had gone up.
No, so he knew something has happened, and he said, I think it may be a leech because the place where he came from has a lot of leeches.
Okay.
And he was coming with nasal bleeding. So we did a nasal endoscopy and saw there is something.
Actually, they hide when they see the light. So that is the
problem with leeches. It shrinks and it hides.
So
and
you can't make out
crevices.
Huh.
So it was a real challenge to get out the leech. You cannot hold it with a forceps unlike other things and take it out. So we had to use ether. We had to give some ether, and that attracts the leech.
Wow.
So it was a real challenge. Other thing, one marble. Somebody,
the kids actually,
11, 12-year-old kid had swallowed a marble. Now we could see the marble in the food pipe, the start of the food pipe. But problem is how to hold it. If it is a denture or something, you can hold it. But marble is round and very difficult to hold it. So we had to really apply ourselves and use a lot of technical gadgets to get out that marble.
My God, there should be a museum to display strange things we got out of people's bodies.
I'll tell you one interesting incident. One lady educated, a teacher in a college, she came with dhatura stuck in her throat.
Oh my God.
Her mother-in-law gave that and she was supposed to swallow it whole because some infertility issue, some baba gave that dhatura to her.
And it's just got stuck.
That lady was a doctor, professor. Now, she said, I know I have done a foolish thing. She
but
realized,
take it out now.
Dhatura seed.
Safety pins are very common.
Safety pins?
Yeah.
Well, why are people swallowing safety
pins?
pins?
One lady was tying a sari and she kept a safety pin at the mouth and she swallowed it.
Wouldn't that also sort of lead to, unless it's not open, it's shut?
He swallows, then it finds its own path in the food pipe.
It may go out
It may cause damage, it may go out of the food pipe. All this happens.
Dentures are very common. Loose dentures, they accidentally swallow. Mutton pieces with bone, meat pieces with bone. And sometimes they forget that it was there. They may come back 2-3 months.
Oh my God! Guess that dinner that you had.
Fish bones.
Okay, as we end this, one question that everyone wants to know. Can I have cold water?
It depends from person to person. Some people can have and nothing happens. But those who are prone to allergies and they do not tolerate, so it's better not to have it rather than have so many medicines.
Is it even an age thing that
with
below
age,
or after?
With age, I for myself know I used to love cold water, but now I can't have it anymore. So
it is not a generalization. It depends on how sensitive your throat is. It may vary from a person to person.
Right.
If it doesn't cause anything, nothing wrong in having throat water. But if you find that as soon as you have throat water, you start having sore throat and other things start, then better avoid it.
So this is like an experimentation thing.
Yeah, it is.
Have cold water, figure out if it works for you otherwise.
Yes.
Thank you both so much for coming here because I think this was really interesting. We got a lot of interesting information, a lot of wake-up calls. But that's it for this week on Your Health Decoded. You can write to me at manika@decoder.com and write in with your questions, something we haven't asked, and we'll get Dr. Handa and Dr. Handa again, and they could answer any other questions you have. Thank you so much.